Hello everyone, a very good morning. Today let's discuss on stroke in children. I've taken this whole topic from IJPP article. Okay, so this will be a very useful topic even for your Viva question session also, and also for your theory exam. Yes, going on with the definition, according to WHO, what is stroke? What is the definition of stroke? So stroke is nothing but a clinical syndrome. So stroke is a clinical syndrome which is consisting of rapidly developing clinical signs. So that consists of rapidly developing clinical signs of focal disturbance. It can be either focal or it can be a global disturbance also. So it is, you have to note that every word is important in this. So it is a rapidly developing clinical signs of focal disturbance of your cerebral function which is lasting for more than 24 hours. Okay, or the same symptoms that is leading to death with no apparent cause. So this is the definition of your stroke. So it's a clinical syndrome which is consisting of rapidly developing signs of a focal disturbance in your cerebral function which is lasting for more than 24 hours. Okay, here we have two types of stroke. According to the age wise category, we have divided the stroke into two types. That is, one is perinatal stroke, another one is childhood stroke. So what is perinatal stroke? So when the child develops the symptoms of stroke between 28 weeks of gestational age to first 28 postnatal days of life is called as perinatal stroke. That is, from 28 weeks of gestation to 28 postnatal days of life is called as perinatal stroke. What is called childhood stroke? That is, from your 28 postnatal days of life till 18 years of age. When the child develops the symptoms of stroke between 28 days of postnatal days till 18 years of age is called as your childhood stroke. Next, going on to the classification and types of stroke. It can be either a ischemic stroke or it can be your hemorrhagic stroke. First. Second, it can be an arterial stroke or it can be your venous stroke. Third, it can be either your anterior circulation stroke or it can be your posterior circulation stroke. So you have to you need to know about each of these, that is both ischemic, hemorrhagic, arterial, venous, anterior and posterior circulation stroke in detail for your Viva session when you are attending a case on a child with stroke. Okay, next, what is TIA? So you all know TIA is your transient ischemic attack. So what is the definition of your transient ischemic attack? So definition of transient ischemic attack is when there is a focal neurological deficit. So when there is a focal neurological deficit that is lasting for less than 12 hours is called as, lasting less than 24 hours is called as your TIA. Okay. So transient ischemic attack is nothing but your focal neurological deficit that is lasting less than 24 hours is called as your TIA. Next important Viva question is your stroke mimics. So what are the conditions that can mimic as a stroke? So here you have a mnemonic, that is HEMI. H stands for hypoglycemic episodes, that can mimic as a stroke episode. E is your epilepsy. M stands for your multiple sclerosis. It can be migraine. I stands for intracranial tumors and infection. Okay, so these are your stroke mimics. If they ask in your Viva session, you have to answer this. Right? Yes. Next, we'll go into detail about arterial ischemic stroke. So what is arterial ischemic stroke? When there is an infarct in a defined arterial territory due to either thrombotic or an embolic phenomenon, you get this arterial ischemic stroke. So when there is an infarct in a defined arterial territory which can be due to either thrombotic or your embolic phenomenon is called as arterial ischemic stroke. Your arterial ischemic stroke is the most common form among the classified. We have classified as ischemic, hemorrhagic, arterial, venous. No, so among that, your arterial ischemic stroke is your most common form, which is which is about 53 to 85%. So occurrence of your arterial ischemic stroke is around 53 to 85%. What is the etiology behind your arterial ischemic stroke? First one is your most important cause is your cardiac cause. So among the cardiac cause, it can be either congenital heart disease or it can be your acquired heart disease. Acquired heart disease like your rheumatic heart disease, infective endocarditis, or when there is a cardiac catheterization. These are some of the etiological causes that can lead to your ischemic stroke, arterial ischemic stroke. Second etiology is your hematological cause. Okay. So among the hematological cause, we have first one your sickle cell anemia. Second one thrombophilia, which is a prothrombotic state. Third cause, they have given it as iron deficiency. This idea is nothing but your iron deficiency anemia. But iron deficiency anemia is not the direct cause for your stroke. It can be a triggering factor for the stroke to occur. Fine? Yes. Next etiology is your arteriopathy. Okay. This arteriopathy, the etiology behind arteriopathy, you have many etiologies behind your arteriopathy, but this arteriopathy has the highest risk of recurrence of the stroke. So they have an increased risk of recurrence. Right? Yes. So this arteriopathy, what are the causes behind arteriopathy? First one is your idiopathic focal cerebral arteriopathy. Second one can be a post-varicella. It can be due to post-varicella, that is after your chickenpox. It can be post-varicella arteriopathy. Third, it can be due to vasculitis. Either it can be primary vasculitis or your systemic or infective vasculitis. So fourth, vasculitis itself is a separate topic. I'll deal with vasculitis separately. Okay. So vasculitis, it can be your primary vasculitis or it can be your systemic vasculitis or it can be any form of infective vasculitis, right? Next, fourth cause of your arteriopathy can be your moya disease. It can be either your moya disease or it can be your moya syndrome. So what is the difference between your moya disease and moya syndrome? Yes, we'll talk about this. So MMA is nothing but your moya angiopathy. Okay. So when there is a chronic progressive cerebral, so it is nothing but your chronic progressive cerebral arteriopathy. Okay, so there will be a progressive occlusion. So progressive occlusion of your bilateral terminal portion of internal cerebral artery. So there will be a progressive occlusion of your bilateral terminal portion of your internal cerebral arteries. When there is a occlusion of your internal cerebral artery, there will be a development of the collaterals. So there will be development of collateral blood vessels or collateral anastomosis pathway at the base of the brain, which gives you the appearance of a smoky appearance, or that is puffed smoke appearance. That will be your main classical finding in your Moyamoya disease. So what is the difference between your Moyamoya disease and Moyamoya syndrome? So that is the topic we are talking here. So here we have two types, that is primary and another one is secondary. Primary is nothing but it is an idiopathic. There is no cause for this. Primary is always, most commonly it is idiopathic only. It's an idiopathic vasculopathy. This is called as your Moyamoya disease. While secondary, this is associated with other causes. So associated with other causes like, or associated with secondary causes like Down syndrome, sickle cell anemia, Williams syndrome, or your neurofibromatosis type 1. Okay, so when your Moyamoya angiopathy, when it is associated with a child having a Down syndrome or sickle cell anemia, Williams syndrome or neurofibromatosis type 1, it is called as a Moyamoya syndrome, not a disease. Right? So this is called as Moyamoya syndrome. So this is the difference between your Moyamoya disease and your Moyamoya syndrome. Right. So we are talking about the etiology for your arterial ischemic stroke. So in this arterial ischemic stroke, the third etiology will be your arteriopathy. So in arteriopathy, you have idiopathic focal cerebral arteriopathy, post-varicella arteriopathy, vasculitis, and fourth one will be your Moyamoya disease or Moyamoya syndrome, and your fifth one will be your mineralizing angiopathy of your lenticulo straight vessels. Okay, so these are the causes behind your arteriopathy, which is leading to an increased risk of recurrence of the stroke. Next, fourth etiology will be your genetic causes. So in genetic cause, we have metabolic and arterial anomalies. Okay, so among the metabolic, we have Fabry's disease, homocystinuria, and your mitochondrial disease, which can cause the stroke. Among arterial anomalies, you have neurofibromatosis type 1 and Face syndrome. Okay, yes. So this is regarding the etiology behind the arterial ischemic stroke. Fine. What are the clinical features behind your stroke, or what are the symptoms that is indicative of a stroke where neuroimaging is indicated? So this can be another one of your Viva questions, that is the symptoms which is indicative of stroke that is requiring neuroimaging. So first one, when there is a new onset focal seizure. Second, when there is a new onset severe headache. Third, when there is an altered sensorium or altered mental status. Fourth, when there is a new onset of ataxia, vertigo or dizziness. Fifth, when there is neck stiffness Sixth, when there is an acute focal neurological deficit. So these are the some of your important symptoms where you require a neuroimaging. The first neuroimaging you have to take in this child will be your CT brain to rule out the hemorrhagic stroke. But the investigation of choice in child with stroke is always your MRI. Okay. Next, we'll talk about anterior circulation stroke and posterior circulation stroke. Here in this, anterior circulation stroke is more common than your posterior circulation. So anterior circulation stroke is more common than your posterior circulation, right? So this anterior circulation involves your anterior cerebral artery and your middle cerebral artery. So among your anterior cerebral artery territory and your middle cerebral artery territory, your middle cerebral artery territory will be more common than your anterior cerebral artery territory. So what will be the clinical features of your when there is a block or when there is an infarct in your middle cerebral artery? So there will be a features of contralateral hemiplegia with or without contralateral hemianesthesia. There can be aphasia. Or can be a apraxia. Well, when the infarct involves your anterior cerebral artery, there will be a weakness of your lower limbs. Second, there will be a loss of voluntary control over your micturition. Third, there will be a behavioral and memory disturbance. So this is regarding your This is regarding your anterior cerebral artery territory and middle cerebral artery territory. Next is your posterior circulation stroke. So this posterior circulation stroke, it is involving your posterior cerebral artery, vertebro-basilar system, and it involves all brainstem stroke. So I am not going into the detail of your brainstem stroke syndromes. Okay. So the clinical features when it involves a posterior circulation region, the clinical features in the child will be your ataxia, vertigo, diplopia, vomiting. Okay, these are the most important clinical features when it involves your posterior circulation territory. Okay, the signs, there will be a sensory loss, pain, movement disorder due to your thalamic involvement, and visual field loss will be present, and cortical blindness. So I have not gone into a detail of your brainstem stroke syndromes here. Okay. And next, going on to the investigation. MRI is the investigation of choice in a child with a stroke. At least if there is MRI not available in your system, at least do a CT brain with angiography within 1 hour of your arrival. CT brain is the initial imaging if your hemorrhagic stroke is suspected. But this CT brain will be normal in first 12 hours of your ischemic stroke. Okay. Right. Next. Another one investigation you have here in imaging is your DSA. What is DSA? It is nothing but your digital subtraction angiography. It is nothing but your digital subtraction angiography. It is an investigation of choice that helps in detection of your vasculitis and your collateral blood flow and your aneurysmal anatomy and all. It helps to define that. Okay, it is mostly the investigation of choice in the detection of vasculitis, collateral blood flow, and for your aneurysmal anatomy. Okay, this is regarding the imaging investigation of choice. And what are the blood investigation or other investigations that is required in a child with a stroke? That is your first tier investigations. I am writing only the first tier investigations here. The first tier investigations will be, first is your CT brain with CT angiography. Second one will be your MRI brain with or without your MRA and MRV. Okay. Third will be your CBC, peripheral smear, and sickling test, because you need to find the etiology behind the stroke in this child. Fourth will be your RFT, LFT, and you have to screen for other infections. Fifth will be your coagulation profile, your pre-T and APTT. Sixth will be your cardiac evaluation, that is you have to do your ECG and echo to rule out any acquired heart disease in that child or any congenital heart disease. Okay, so these are the first tier of investigation in a child with a stroke. Okay, next is regarding your treatment. So regarding the treatment, it is a very short topic only. I will take this in a separate video. Thank you.